In terms of the team, they'd got together how they were going to do things, but there was a real need to get some very clear messages out really quickly. We'd actually started working with TEC Cymru back in September 2019 to build a website, because it meant that we already had in place the plans to put a huge amount of information and content, so that there were videos on how to use video consulting that made it easy to understand for both patients and clinicians.
Video consulting is simple and easy to access. All you need is a smartphone, tablet or laptop.
We also developed a toolkit to support the use of it, which contained lots of how-tos, so that anybody that wanted to deploy the VC service could go to this for all their supporting materials.
We had a Twitter channel which was up and running very soon. We had videos that we recorded with clinicians who had just started using it to share. It was making sure that we had all the guidance and tools available so that this could be done in a safe and timely fashion.
We have been able to make sure that we have got virtual calls, video calls able to be undertaken by GP practices across Wales. It would be an exercise that normally would take us months, if not years, to work our way through to implement, and we've been able to achieve that just really in a matter of a couple of weeks.
We were asked by Welsh Government, first of all, to prioritise general practice. There were a lot of initial issues that were picked up around the type of kit that was being used, even down to how we're going to help GPs who themselves were shielding.
We've been working with the Bevan Health Board team for quite some time on the pilot, so they were best placed to really understand what was needed within that area. They were set the challenge of delivering the solution to around 100 practices within, I think, a month, and they delivered that within about 2 weeks. And that's where primary care services came in. And they had another 300 or so practices to tackle across Wales. And they delivered such a slick model for getting it out there, getting people trained, getting people aware of what it meant and how they could access training.